Well, hello everyone. Thank you for spending some time with us. I'm Pat Cronin from Butler Media Agency up in Rochester, New York, and with me today is Kelly Gardiner. Would you like to tell us from Care+Wear, Innovative Healthwear? Can you tell us a little bit about what that is and where you've been and where the brand has been?
Yeah, I am Kelly Gardiner, as Pat mentioned. I'm the Chief Marketing Officer of Care+Wear. So we make adaptive healthwear. What does that mean? Healthwear is not a word probably most folks have heard about. So this is everything from a PICC line cover, chest port top, post-mastectomy, recovery bra, if you've dealt with breast cancer. And then we also have an enterprise side of our business where we partner with hospitals and health systems to kind of redesign the patient experience. So updated patient gowns so your butt's not hanging out, updated scrubs so that nurses and doctors feel really comfortable when they're out taking care of you. I've been with the company for a little under 6 months, so I'm still pretty new, which is exciting, but excited to talk a little bit about kind of our brand today.
Yeah, absolutely. In prepping, I loved I think we can call it a mission statement on the Care+Wear website that really struck with me, because I think if we're looking at ourselves, I'm a patient. Maybe you're a patient, maybe you're a patient. I know I'm a father of patients. And so something that stuck with me was that Care+Wear is helping patients and HCPs feel more human in the hospital. And I think back, if I can share a personal anecdote real quick, my 1-year-old has some respiratory issues. So we're in the hospital in which the IV for young folks is inserted into the hand, not into the arm. So she had this huge IV plastic cover off of it and tubes coming out of her nose, and it just felt very impersonal and inhuman. So I love that brands are taking the initiative to make that hospital and that care feel a bit more like home in a way. So it's a very, very passionate thing.
Thank you for sharing that about your mom.
Yeah, you're welcome. Okay, so we're going to talk about some tips and tips that you've seen, both from a brand standpoint and perhaps from an industry standpoint too. So can you tell us a bit about the Care+Wear journey to this point? Where has the brand been from a marketing standpoint, perhaps early days, maybe generating awareness or in what channels you're playing in or anything like that, and what the outlook looks like in the next 3 to 5?
Yeah, absolutely. So the company actually started 10 years ago, which I feel like if you're at a startup and it's 10 years old, you're kind of like, wow, that's a very mature organization. But it has seen a lot of different iterations of the customer focus, the product focus. Really started as a healthwear business. Our founder had a loved one who was told to put a tube sock over their arm when they had a PICC line in. And anyone who's been in the hospital knows, like, we shouldn't be putting socks on any injection areas or like literally anything. So he worked with a couple of designers and medical professionals and really started designing products that were going to be better built for people. And so that's where we started. Speed up to the pandemic, and there were a lot of doctors and nurses who needed PPE. And because of this product experience that we had, we were uniquely positioned to create better products for doctors and nurses during the pandemic. And so after the pandemic, we then kind of worked with them to develop scrubs and gowns and all of that kind of stuff. But the organization for the past 10 years has really been focused on community building, mostly on social, but also just being in community with the people that we're serving. We support a lot of like 5K runs and you might call it like micro influencers, people who don't have 30,000, 100,000 followers, people who have 5,000 but can really speak to the lived experience that they might be dealing with, someone who has a chronic condition that's very nuanced or very small in terms of the people who are affected. So I think we've grown and we've changed a lot in terms of the products and the audiences that we serve, but we've always been really focused on making sure that we're supporting our community, and we also just spend a lot of times making sure that we are in the places that people will be when like the worst thing in their life happens, which is they have cancer, one of their loved ones has cancer, and so that is a lot of time spent on Google Ads, making sure that we have the right content for people, making sure that they'll find us when that moment happens to them or a loved one.
Wonderful. So the sense of community has kind of been a theme throughout the day, and the sense of authenticity. So the Care+Wear Instagram account has a real focus, I would say, around the patient stories, I guess you could say. So for a brand as personal as Care+Wear, I imagine that authenticity plays a big part of that, and that sense of community that you just talked about, and appealing to the patient audience as a trusted peer. Can you provide some tips on how that's gone well, or some patient stories, or maybe an anecdote in particular? Or on the flip side, where has that fallen down, where authenticity didn't ring true, or the sense of community wasn't there, or something like that?
Yeah, so our design model is such that our patients, clinicians, and we partner with different designers. Oscar de la Renta, we work with them to create our chestboard access hoodies. We work with Notori, who's a luxury sleepwear brand, to make our scrubs. And so our whole thing is we trust people who are experts in that thing, fashion, function, with clinicians and nurses and patients. And so the thing that we really try and do is when we're innovating a new product, when we find out about this need for it, we talk to the people who are actually dealing with it. And when we were getting ready to launch our scrubs a few years ago, we were super psyched. We were like, these are the best scrubs that anyone has ever seen or touched or worn. And we brought them to this nurse panel that we work with, and they were like, they suck. These are not, they don't have enough pockets, they don't have enough functionality. Like, we're running around lifting 300 pounds of bedding and like, they look prettier than what we have, but they're not functional. And that is disappointing. And I think that is your customer telling you what they need.
Primary research from the horse.
Yeah,
exactly.
Yeah, and I think we have that built into our DNA in terms of how we decide what products that we're going to create, how we're going to bring them to market, who we're going to help, and who we're going to serve, and then who we're going to listen to.
Yeah, I think that's sometimes, like, it's easier than we think it is. Sometimes we read a bunch of data reports and we're like, sometimes if you go ask the end user, like, that's the fastest way to get there.
Yeah, I think everyone today has had that kind of same theme of like, well, if you just ask the person that you are selling this product to what they think, they would tell you. And sometimes they tell you how they want it marketed to them, which is also cool.
I will say, the fleece scrubs, I'm not even a clinician or HEP, but that looks comfortable from my perspective. So can you tell us a bit about your audience targeting approach? And perhaps, I didn't specifically write this down, but like how data is weaved into your audiences. Clearly, you're targeting some HCPs from the scrubs and things like that, but also you're targeting patients. Talk about what's working well there. Perhaps even a question that comes to mind is if patients aren't researching Care+Wear, do you have any campaigns that are targeting the HCPs to refer the patients to Care+Wear? Like, hey, check out this website. It's really good, comfortable stuff for your condition.
Yeah, so on the patient side, unfortunately, there's almost 200 million people that live with chronic illnesses or conditions. There's 2 million Americans diagnosed with cancer every year, so there is a growing population, unfortunately. The way that most people find out about it as first is from a caregiver or loved one. Gifting is a huge part of our business because when you get diagnosed with anything, your first thought isn't, what am I going to wear? Your first thought is, how do I take care of myself? How do I make sure that my life is long and healthy? And so we spend a lot of time putting together guides for people who are maybe supporting a loved one, have a loved one who's dealing with a cancer or chronic condition. And so, directing people who are in that support role is the first thing that we do. And then we also do a lot, folks maybe if they're in treatment, if they're in the process of getting long-term care, they will come in contact with nurses, that kind of thing. We do that, I would say, again, at the community level. We go into hospitals and we work with PICC line nurse teams, breast cancer teams. Like, it has to be on the ground because you can't really email a nurse and say you should share this product with people. it's kind of amazing that it's so different than traditional digital marketing, because you have to go in and be like, this is the thing that you might need to take better care of your patient, and you're sitting there and you're having a conversation with them. So it's really caregivers and, getting on the ground and showing people how to use products.
Yeah, that peripheral marketing, I guess you could call it. Indirect, I guess is another way to phrase it in a different way. So great. Can you tell us about your marketing partnership ecosystem? So working with either agencies or peers or others to get the most out of your marketing effort, and how do you engage those partnerships, and what has worked well? What do you bring in-house? What tips do you have?
Yeah.
7 questions in one.
Okay. So I think Pat and I were talking about this earlier. We keep the thing that we think is most unique to us in-house, and that's really our relationships with influencers. We built out a pretty big team that manages that. That's just because that is, to us, the most important relationship that we have in our business. It is also the human relationship, and these are people who are offering, when they are going through cancer treatment, to take pictures of themselves wearing our product. So it's not to say an agency couldn't handle that, but I think we feel a deep sense of responsibility to maintain those relationships. And having spent almost 10 years agency side, my best clients were always the ones that treated me like a business partner, and kind of made the business my responsibility and helped me understand the bigger picture, because I think when I was younger and I was an account executive, I was like, how do they not get this is the most important thing? And I had such great mentors who kind of helped me understand the entirety of the business. And so when we're looking for partners, that's what we're looking for. People that understand the entirety of our business and that are curious about how to help it grow and how to aid those business goals that we have.
Yeah, absolutely. How much do you rely on other outside eyes, if you will, for innovation, or or confirming or correcting our understanding of where we're going, and just having a buddy check to say, I think you're off base on this one, and this that audience isn't who you think it is, or that messaging doesn't resonate, or things like that. To as a partner, like you said.
I'm glad you asked that, because this morning our agency was telling us how wrong we were on some Amazon targeting.
And sometimes that's the best news you can hear.
Yeah, I mean, I'm really lucky. Everyone that works on our marketing team and our business operations team is like, if you can find out something about our business that we didn't know, so we can get smarter, not make the same mistake again, and ultimately get our products to the people who want them, that's a win. Doesn't matter where it comes from, and as long as we don't make the same mistake twice, that's kind of, to us, that's great. Yeah.
Yeah, absolutely. I feel that. So we talked a bit earlier about some channels and how to reach, I think now, if you think about it, maybe 4 different generations in the patient population at the same time, and their media consumption or marketing consumption patterns and behaviors. In fact, I saw a clip about comedian Taylor Tomlinson, and she was teasing a 21-year-old audience member, and she goes, have you watched anything over 4 minutes? So it's a challenge, right? So how do you work that in terms of your messaging and your marketing and your outreach? I know a lot of it is community-based, like you said, and kind of building that trusted peer relationship to tell that story. Do you have stratified strategies? Audience stratifications where you're deploying different techniques and strategies for different generations, either age or other demographics?
It's interesting. The thing that is most important to us is credibility. We're dealing with medical products, and we have to be able to say there's a reason we should be the authority. And so we spend a lot of time finding the right partners who we can work with on content that we create, really targeted, I would say, mostly by disease category and different kind of type of cancer, because that's how Google shows us, that's how people are searching for things. Content being the unifier, channels being the real strategy for us. We know our gift givers are on Meta, that's where they are, that's where they're searching for things. People engage with our comments. We usually, anytime we put up a Meta ad, there's usually almost 7,000 comments from people like, you should see this, Deborah. Deborah, this is amazing. And it's
My mom is one of them.
yeah, Pat's mom is a big fan. And so there's a lot of looking at how these different channels are built and who they're for.
Yeah.
And so that's really how we target it, because unfortunately disease and illness is a unifier and can sometimes transcend, the content that people need.
Yeah, the gravity of a diagnosis has its own weight to it that a community forms around that person to truly build that. Yeah, absolutely. Moving over to some more macro trends, if you will. Recent Gardiner, maybe their Q1 quarterly CMO interview, I don't know. But the marketers are being asked to do more with less these days. It feels like we're being demanded to drive more results, get more down funnel. So how can health and wellness CMOs do more with their budgets or with their staffs? Any hunches or predictions on where things are headed in the next 5 years, whether that be innovations or trends? So how can marketers do more with their budgets today?
Yeah, I think it is. I might get some flack for this, but I think it's great. And the reason is because I think there is a clarifying factor that comes with being asked to do so much. And being asked to achieve such audacious goals oftentimes. I don't know anyone who has goals that are easy to reach, especially in retail or e-commerce. And I think it is a forcing function that's happened over the last 10 or so years. Most of my previous experience in the last 10 years has been working for venture-backed companies. And so that comes with a very unique pressure to hit goals or not getting any more money from investors. And so I think that the marketers who have kind of seen that as an opportunity to trim what actually isn't contributing to revenue, what isn't contributing to brand affinity, is great. But it also means you have to be, I hate the word, scrappy. So I think it's forced a lot of refinement
and innovation too. If you're giving you a needle and a shoestring, go make a raft out of it. It forces innovation too, right?
Yeah, and I also think it forces. I can't remember who was talking about it earlier when all the Vitamin Shoppe folks were up here, but your social media person being your best friend, should be in a lot of brands because they're the ones having the direct relationship with your consumer. And so I think it just also forces us to refine the layers and the different levels that we're looking at, so we're not so loaded up and the people who are on your team are actually doing the work.
I'm interested in a trend that I've kind of seen in the marketplace. What advice would you have for marketers who are trying to balance what I guess I would call more longer-term brand marketing efforts with shorter-term performance marketing? So perhaps if you take some budgets and shift towards performance marketing, maybe you're selling yourself short on the long-term game, but you're getting increasing Q3 performance or whatever. So how should marketers think about that and balance that out?
I think.
Sorry, first question. Do you see the same trend? Do you feel that same pressure?
Yes, in my last role, I focused entirely on brand marketing, and I think that was a unique pain that I got to kind of endure and understand, because I think in bigger organizations, I think you can kind of say, this is the brand budget, this is the performance budget, but to me, and kind of the way that we try to operate in Care+Wear is, brand is everything you do, and that is contributing to the perception and people's willingness to buy or not buy your product. And so to me, being anemic there is a long-term, a chance for long-term failure, because you can't go back and say, oh, we invested all of this energy into brand equity, brand building. So I think as marketers, you're kind of always doing the balance and always looking at, what are my goals? How can I not be so short-sighted, because everyone wants to see the dollar in, dollar out. And I think, to your question prior, we just don't have the budgets, we just don't have the teams that we used to. And so we have to be really clear about, do we want this to be a sustaining brand, or do we want the click today, or do we want the brand in 10 years? Yeah. So I think it's a forever fun balance.
Yeah, absolutely. Finally, so e-commerce, a big expanding and complex part of the marketer's ecosystem, especially in health and wellness. What's worked best for Care+Wear? What's worked best for Care+Wear?
In what way?
I think I thought of the question from like a brand equity standpoint. Like I think about e-commerce sometimes especially with third parties, involves a little bit of like, I'm trusting you with my brand equity on your site, or like, like I don't control the story totally. So how has that worked well, where you maintain a consistent message for your audiences throughout that? And then I guess I don't mean the question from a financial standpoint. Okay.
I would say it is a challenge. Marketplaces or Amazon, Walmart, that's where people buy things. And so that's where we want to be. I think it is not without you have to concede a lot in terms of how you understand what is driving purchases, audience data, all of these things, but it's also, we want to be where our consumers are. And so I hate to copy and paste my answer from the last time. Amazon does very well for us, and we have a lot of success there, but that's also, long term, our hope isn't for that to be a revenue stream that we have to count on. So I think it's in the near term, looking at where customers are, making sure our products are there, and then over time building something better.
I love that. Any other topics you'd like to cover? I'll give you the open floor at the lectern.
No, but if anyone has any questions for Pat or I.
You talked about agency. You came from the agency world and then VC-backed companies. Did you work on healthcare or apparel? Like, what was kind of the journey into Care+Wear?
I worked on agency side. I worked for Accenture, so helping them build what became an agency killer that they now have. So no healthcare experience. And then I worked for an organization that did alcohol use disorder support online for people. And then I went to 30 Madison, which is a big telehealth organization. And so I think I caught the bug. I was so obsessed with being like very close to the people that I got to work for. And so that was my journey.
Okay.
Thanks, guys.
Thanks, everyone.